If you're going through what's called the second puberty, you don't know how to get rid of adult acne, or you have marks you want to remove, this is your video. There's a widespread idea that acne is something that only happens during adolescence, but there are many adults who still struggle with this problem, which causes a lot of frustration. Beyond its undeniable impact on your appearance and self-esteem, acne is the result of inflamed skin and habits that could be greatly improved. Yes, our lifestyle is comedogenic and promotes acne in different ways that you might not even be paying attention to, but that I'm going to tell you about in today's video. What are you going to learn? Well, it's very simple. I'll explain what acne is and why it happens, and then you'll see the main factors that cause acne in adulthood. We'll continue with the essential habits to prevent acne, and finally, I'll tell you about the best products I've found to prevent acne or help with the acne you already have. This will be at the end of the video in case you're interested. Let's get started. What is acne and why does it happen? Acne is a chronic inflammatory disorder of the hair follicle and the sebaceous gland. Both together are called the pilosebaceous unit, and they are found in abundance in areas like the face, neck, chest, back, or the upper part of the arms. Yes, you've noticed that we usually don't get acne on the calf or the forearm. Alright, everything starts with an initial precursor lesion, which we call a microcomedone, a small plug of dead cells and oil that later develops further. There are closed comedones, the white heads you want to pop, open comedones, the black heads you want to remove, inflammatory papules, pustules, and nodules, which are the most severe lesions we need to try to avoid. Now then, why do we get acne? Well, first of all, I'm sorry to tell you, it's because of your genetics. The type of oil that causes acne has a heritability of between 50 and 90% according to some studies, which is a lot. That means if your parents had acne, it's very likely that you'll have it to a greater or lesser extent, though not always to the same degree. In any case, you can always improve it. Second, because of a hypersensitivity to androgens. These hormones stimulate the growth and secretory function of the sebaceous glands, producing an excess of sebum or oil, which we call seborrhea. You don't necessarily have to have very high levels of androgens to have acne. What actually exists is more of a hypersensitivity to them, especially to DHT at the local level. It's somewhat similar, though different, to what happens in alopecia, for example. However, it's true that any condition that raises androgen levels above your baseline, such as polycystic ovary syndrome or testosterone treatment, whether in men or women, can contribute to acne. As you know, it's one of the most common mild side effects in testosterone treatments. Third, dysbiosis of the skin microbiome and proliferation of Cutibacterium acnes. This bacterium, although a common commensal on the skin, plays a key role in acne because it breaks down the triglycerides in your skin's sebum, turning them into free fatty acids and glycerol, which allows it to thrive and grow uncontrollably. Basically, it feeds on your skin oil. Azelaic acid is a compound, a natural dicarboxylic acid that has a very useful antimicrobial effect for eliminating the bacteria. We'll talk about it later, so if you stay until the end, you'll learn a lot. As if that weren't enough, this bacteria in dysbiosis triggers innate and adaptive pro-inflammatory immune responses, which, when acne is severe, leads to the inflammatory lesions we fear so much. Alright, now that you know the pathophysiology, let's look at some very common risk factors. I call them the biggest acne triggers in adulthood, which obviously also apply to adolescents. Alright, first, did you know that many current hunter-gatherer tribes simply don't experience acne at all? This tells us something, and it's that our Western lifestyle is very comedogenic and far from what our skin expects from us. So you need to review the following factors and eliminate them from your daily life. First, excess friction and occlusion. These are purely mechanical factors. Frequent use of occlusive items like backpacks, headbands, or shoulder pads in areas with a high density of follicles causes acne. Also, the use of oil-based cosmetics that promote the blockage of the pilosebaceous opening leads to the formation of microcomedones. We'll talk about that at the end of the video. Also, not removing hair products before going to bed, like waxes or greasy styling gels, can transfer to your face. This is a mistake that, I admit, I sometimes kept making out of tiredness. Removing your makeup improperly or not removing it at all causes microcomedones from clogged pores, which later turn into acne. An unhealthy diet. The consumption of ultra-processed foods, a diet with a high glycemic load, lots of simple sugars, and high intake of unfermented dairy products have a negative impact on the appearance of acne. There is stronger evidence for ultra-processed foods and sugars and less evidence for unfermented dairy products. Simply by changing this factor, you have a lot to gain. There are people who are so sensitive that just by eating ultra-processed foods once, the next day they already have an acne breakout. And there are less sensitive people who really don't have this impact. Psychological stress. Do you think that more work, family, or any kind of stress will cause more acne? Through the gut-skin axis, psychological stress impacts the pilosebaceous unit, facilitating sebum production, hyperkeratinization, and generating microcomedones. Learn how to identify chronic stress with the tips I give you in this other video. Some medications, such as certain contraceptives, lithium, or anticonvulsants, can also exacerbate acne, and you will need to consult your healthcare professional about this. If you paid attention to the previous points, you will have noticed that what we want is simple: to avoid inflammation, to avoid excess dead skin cells, to avoid hyperkeratinization, and to avoid excess oil in the pilosebaceous follicle. How do we do this? With these habits, 2 things have helped me reduce my adult acne to less than half of what I had before: changing my diet and properly washing my skin. Por la mañana y por la noche. A very simple example regarding diet. I have noticed that dark chocolate with 85% cocoa or higher, a very high percentage of cocoa. It doesn't cause me any acne at all, but if I go below that percentage, I probably get more acne. There are many similar examples you'll need to identify in your diet. Now let's move on to cleansing. Regular soaps, and very few people know this, usually have an alkaline pH between 8 and 10. They irritate and dry out your face, damage your skin microbiota, and harm your skin's barrier function. From now on, are you going to look for a Syndex cleanser? Synthetic detergent that has a pH similar to that of the skin, around 5.5, by respecting the skin's pH, it cleans dirt without destroying the natural lipids of the skin barrier. What you're going to notice is a pretty clear subjective difference. Instead of leaving your skin tight and dry like most soaps, Syndex leave it soft and hydrated. At the video's end, I'll show you a great one, but be careful, overwashing your skin can irritate and dehydrate it by disrupting its flora. Even with Syndex soaps, in other words, wash your face ideally in the morning and at night. Let's continue with using non-comedogenic products. Your oil-based or very greasy products block the pilosebaceous opening and make acne worse. Look for non-comedogenic labeling, preferring oil in water emulsions or liquid hydrogels. Constantly changing your routine or using too many products at the same time usually makes inflammation worse. Also, that's why I like to look for minimalist routines, meaning just the bare essentials. I prefer a few quality products over 8 low-quality ones. Photoprotection. Protecting inflamed lesions and those in the healing process is important. This prevents post-inflammatory hyperpigmentation, meaning those persistent dark spots from remaining where the lesion was. And actually, I have a few myself, as you can see, because I didn't do things properly. It's also very important not to pick at pimples yourself. This pushes the pus and bacteria into deeper layers, which increases inflammation, spreads breakouts, and greatly raises the chance of developing permanent scars. Alright, all of this is an explanation of what you shouldn't do and what you should do, but sometimes you need to put yourself in the hands of a professional. Fortunately, acne has very effective treatments, and the vast majority of cases will improve greatly or even be resolved. Your dermatologist always has to be the one. This professional will guide you on which personalized treatment is best for you. Topical retinoids, benzoyl peroxide combinations, azelaic acid, topical antibiotics, oral retinoids, depending on the severity. But of course, many of you ask me for cosmetic products to prevent acne without a prescription. Well, that makes sense. And I'll tell you which are the best ones I've found, mainly to prevent breakouts, but also to improve the ones you already have. There are 4. I'll tell you, I've talked to you about the importance of washing your face properly, about cleansing. So obviously the first product will be a cleansing gel, and honestly I love this one. The foaming cleansing gel from CeraVe, you see? It's a gel for normal skin, leaning towards oily like mine. My skin is pretty oily. It's a soap without SLS, non-comedogenic, neutral pH, gentle on the skin, and fragrance-free. For me, it's a game changer in acne prevention and the first step that any anti-acne routine should have. Clean your face well, okay? Wash your face. Then, we have the ultra-concentrated FAT serum from La Roche-Posay, which is meant to reduce marks, and the cleanser is a gel which contains glycolic acid and niacinamide. But yes, this precaution is very important. I recommend using the Cera Cleanser, which is a gel, a cleanser that is a gel, Cera Cleanser, which is a Cera Cleanser. If you already use retinol at night as a supplement and you have a lot of previous acne marks or infections, Effaclaracita from La Roche-Posay is also a gel cream that helps improve those marks in record time. Remember that the azelaic acid it contains, which I mentioned before, can be a useful option when post-inflammatory marks are predominant, residual erythema or mild to moderate acne, as long as the skin tolerates it well. And finally, the Capital Soleil UV-Age Daily Sunscreen from Vichy offers broad-spectrum SPF 50. It boosts your own collagen. It includes peptides and niacinamide, which also have an anti-spot effect. What I like most about this one is its texture. A very fluid, invisible texture, and above all, not sticky at all. Most sunscreens are very sticky. I don't like how they feel on my face. Honestly, it's one of the few whose texture doesn't bother me, so it's also very, very good. Now you have many more tools to fight that uncomfortable adult acne. I'll see you in the next video. Thank you for subscribing and a big hug. And keep empowering yourself.